Hi everyone, welcome to part two of the video series. Today we're going to be talking about strategies for healing and really anything that has to do with your diabetes management and what to do in emergency situations. Uh, I want to start it off by talking about exercise. I know we all know it's important in managing diabetic symptoms. However, it could be difficult depending on what kind of physical symptoms you may be having. A great way to do it if you have a hard time with walking and standing is to even exercise in bed or even exercise on a chair. So there's always a great way to start moving your body throughout the day. There's Tai Chi, there's deep breathing exercises, and as long as you do it consistently, so I'd rather have you do it for 5 minutes a day than to do a 2 hour workout once a month, right? And here's some great ways to exercise with diabetes. So when you have general pain and weakness, you want to build up those muscles that are related to that location of pain. So if you have a lot of pain in your hands, the stronger the muscles in your hand, the less pain you're going to have. Just make sure you don't exercise during flare-ups. You also want to check your blood glucose levels before and after you work out and always have access to a healthy snack. Only use candy bars and other quick carbs to eat when you're in emergency situations. And when you're working out for 2 or more hours, you might need to check your blood glucose levels every single hour. So make sure to bring a snack for that. I know you all know sleep is important, so try to get at least 7 hours every day. However, it might be hard for us due to routines or any pain that gets worse at night. So here's some strategies that we can have to help with that. You want to keep a steady sleep schedule. So you want to sleep at the same time in the same place every single night. If you're expecting to stay up for a weekend, make sure you adjust your sleep schedule a few days before that. So if you need to go to bed at 11 p.m., which is later than your usual nighttime uh, bed schedule, make sure a few days before that you also go to sleep at 11 p.m. That way your body already knows when it should go to sleep and when it should wake up. You also want to turn down the lights, stay away from screens, and install a blackout curtain. That way you are ready to go to bed. You also want to keep your room cool from 60 to 67 degrees. And if you're someone who gets cold, that's all right. Just go ahead and bundle up in layers, maybe put on a sweater or some extra blankets. You also don't want to use your bedroom as a workspace. Your brain and your body is going to make that association that your bed is the time for work and to stay awake. So if you don't have enough space in your room to have a workspace, try to find somewhere outside of your apartment to do your work or your studying. Try not to nap during the day because if you feel well rested, your body's not going to want to go back to sleep. And if you absolutely do need to nap, try to keep it under 15 minutes long. And you also want to drink water earlier in the day. That way you don't have to wake up in the middle of the night and drink water or use the bathroom. More about water, it's extremely important in managing our diabetic symptoms. And a great way to tell if you've been drinking enough water is looking at your urine color when you do go to the bathroom. You want to keep it generally pale, and you should be drinking at least 6 to 8 cups of water as a full grown adult per day. Um, Here are the best ways to hydrate: tap water, obviously, but especially in old homes, you might not be as trusting of the water. You can always call EdMud to get a free water test if that's something you've been scared of, or you can just check your water for any cloudiness, sliminess, color, or other things that make the water seem like it's not exactly safe to drink. You could also install some filtration systems. You can hook a filtration system up to your faucet directly, or maybe filter it through a water pitcher that has a built-in filtration system. Um, Another way to hydrate, if you really can't get in those 8 cups of water a day because you hate drinking water like that, you can also get it through these things, right? Even milk has a lot of water for you to hydrate on, and cucumbers as well. So there are multiple ways to get it, and there's also a lot of ways to become dehydrated, which makes your symptoms a lot worse. Usually anything with a lot of sugar and a lot of salt, alcohol, or caffeine can dehydrate you. Some teas can hydrate, but caffeinated teas specifically can dehydrate you. So just make sure that what you're drinking is not caffeinated. Uh, Here are some phone applications to help with your diabetes management. The pill reminders, My Therapy is a great way to track your medications if you have a lot of it. Uh, Both Android and Apple have medical ID apps to let people know your needs in emergency situations. But if you don't have a phone, or if you don't like using a phone, that's okay. You can also have a medical ID bracelet or necklace. And if you have access to the slides, there's a link right there to get a free one. Um, you could also have pill organizers to help you with medication management. If you're someone who has a hard time seeing, make sure you get something with a lot of bright colors, large font, and a distinction between AM and PM. If you're someone who has a lot of hand grip pain or weakness or arthritis or something like that, push to open pill boxes are a lot easier for that. And if you're someone who has some attention or cognitive difficulties, like maybe you forgot what pill you took, or maybe you have too many pills to keep track of, this talking pill organizer is a great way to do that. And if you'd like to get any of these applications or these things to buy, there's links at the end of the presentation. Here's some applications that help you track your nutrition, your blood glucose levels. It's a great way to look at patterns in your daily mood and your emotions, as well as your blood levels. You could also show your doctor what's been going on with your condition as well. These are all free. However, OneDrop does have the premium option to have individual coaching and advice for your diabetes and health if it's something that you have been struggling with. If you don't have a phone, you can also use a blood sugar tracker in Food Journal. It does the exact same thing, and it also has that physical application to it. So if you prefer that. Um, However, if you do want to learn how to use your phone a little bit more, always you can look at the accessibility settings to make it a lot easier to use. It'll change the font. It'll make it a better contrast. That way you can read it better. You can even have it read back to you. There's also one-handed function controls and voice control if it's something that you would like. And they also have language translation if English isn't your first language. And lastly, I'd like to uh, really call to importance the importance of skincare, right? And skincare is so important to those with diabetes, just because an open wound can cause an infection that your body may not be able to fight off. So you want to inspect your skin every single day, keep your nails trimmed, and you don't want to walk barefoot. You want to wear padded foot support so that way your skin isn't exposed to things that can cause infections. You don't want to stay in one place for too long because that allows your foot to or your skin to break down and cause some pressure ulcers that we don't want. You also want to keep your skin clean and dry, so no sweat or water in between your skin and your clothing, because that rubbing will cause some skin to break down. You also don't want your hands to be too dry or your skin to be too dry. You want to moisturize with lotion once or twice a day. Or when you're working with water and you're cleaning dishes, moisturize after that too. But if you do see a cut, scrape, or a blister, you want to immediately clean with soap and water. You want to dry completely, right? Because you don't want it to be wet. And you want to apply antibiotic ointment and cover it with a bandage or a sock. That way you don't keep exposing it to things that could potentially cause infections. If you want to learn a little bit more about what I talked about, or maybe you want to have the chance to buy or download some of the apps that I've talked about, here are the links. And thank you for listening to this video. I'm looking forward to seeing you in the next one.